I'm so delighted to have here with us today Administrator Chiquita Brooks-LaSure from the Centers for Medicare and Medicaid Services, who will share her vision of where CMS is going and what that means for states. Following this plenary, we're going to have a host of fantastic breakout sessions and roundtables, and then we will come back together to end our day talking about equity, followed by the opportunity for you all to network and talk to one another in a more informal way in our virtual platform. With no more further ado, I am so pleased to introduce Administrator Chiquita Brooks-LaSure. Chiquita is the administrator for CMS, where she oversees programs including Medicare, Medicaid, the Children's Health Insurance Program, and the healthcare.gov health insurance marketplace. She's a former policy official who played a key role in guiding the Affordable Care Act through passage and implementation. She has decades of experience at the federal government, on Capitol Hill, and in the private sector. As Deputy Director for Policy at the Center for Consumer Information and Insurance Oversight, or CCIO, within CMS, and earlier at the Department of Health and Human Services as Director of Coverage Policy. I know that you are going to be enthusiastic in welcoming Administrator Chiquita Brooks-LaSure.
Thank you so much for inviting me to join you here today to help go off mute and turn up the volume on the most timely, cutting-edge issues facing all of us in healthcare. As state policymakers, the work you do is critical in ensuring that states working with us in partnership continue the unfinished work of the ACA and strengthening the Medicaid program. I've spent some time over the last few weeks reflecting on my first 100 days as CMS administrator and my vision for the future of our agency, our programs, and the people we serve. Our team hit the ground running from day one, focusing CMS efforts on improving health equity and access to coverage by working across what I call the 3 M's: Medicare, Medicaid and CHIP, and the ACA marketplaces. I will share that future vision with you today. But first, I just want to take a moment to talk about where we are today. As you know, we are in the midst of the greatest public health emergency in generations, and it's imperative that people in every community have access to affordable coverage and high quality services. No one should be left out, left behind, or left on the sidelines when it comes to healthcare. As we continue to tackle COVID-19, the Biden-Harris administration is focused on providing everyone equal access to vaccinations and testing. Additional funds have been made available to states to make testing more readily available and help cover the cost of vaccine administration. The Biden-Harris administration recently announced that it will expand the previously announced healthcare staff vaccination requirement for nursing homes to additional Medicare and Medicaid certified provider types as part of a forthcoming emergency regulation. This action will address the system-wide issue of unvaccinated healthcare staff, address concerns regarding staffing challenges, provide needed stability and uniformity across the nation's healthcare system, and strengthen safeguards for the health of patients, residents, and the providers who care for them. We applaud the work that you, states, and providers across the healthcare systems that have taken early action and instituted staff vaccination requirements to keep everyone safe. These efforts, while incredibly important and appreciated, are localized. National action is needed to maintain stability within the healthcare system and ensure that every person who seeks care is protected from COVID-19. These actions are in place so we can get our country back and build back better post-COVID-19. We are poised and ready to help support states on eligibility and enrollment actions after the public health emergency ends. This unwinding will take a strong partnership between the states and CMS to ensure consumers are seamlessly covered for necessary services. I am so privileged to lead an organization that is at the forefront that also works tirelessly to ensure that the more than 170 million people with Marketplace, Medicare, or Medicaid coverage know that they will be able to get the care they need. The vision is straightforward. CMS serves the public as a trusted partner and steward, dedicated to advancing health equity, expanding coverage and care, and improving health outcomes. Having marked my first 100 days, laid out my strategy for how the agency will achieve this vision and how we would judge success. To me, everything we do should be aligned with one or more of 6 strategic pillars. We have already made significant progress on these pillars, focused our efforts on improving health equity and access to coverage by working across the 3 M's. I'm going to spend the next few minutes talking about each of these. As the first African-American woman to lead CMS, I want to make sure that our programs are operating to reduce the health disparities that underlie our healthcare system, which were particularly illuminated in the COVID pandemic. We knew these issues existed before today, but we've all seen just how pervasive they are and how problematic they are for the health of our nation. President Biden has made it clear that we're going to address equity with a whole of government approach. And the way we are trying to do that at CMS is by putting how are we promoting health equity as the first question that we ask as we look at every single policy and operational decision. We need to make sure that we do everything we can to break down the barriers to care and lift up underserved communities. We must also make sure that we are listening to the voices of every community, particularly the historically disadvantaged, as we make our policies. When talking about health equity, I'm reminded of the well-known quote from Dr. Martin Luther King. Dr. King famously noted that of all forms of inequality, injustice in healthcare is the most shocking and inhumane. His words are a powerful reminder of the promise of our programs, particularly Medicaid and CHIP, the lifeline they offer, the safety net they provide. I want to affirm that the Biden-Harris administration will not break that promise or sever that lifeline or shred the safety net, especially when it comes to our most historically underserved children and families. We've started a number of actions, and of course, all of you are very much involved in our work in this area. We are particularly focused on the health of low-income mothers, reducing pregnancy-related health disparities, reducing the rate of morbidity and mortality in terms of maternal outcomes by addressing the continuity of care needs for postpartum women. As a mother myself, I remember the challenge of having a newborn, and I can't imagine having to do that and try at the same time to find and access new healthcare coverage. This is why I'm so pleased that the American Rescue Plan now provides states with new options to increase access by extending Medicaid postpartum coverage from 60 days to 12 months. I know that many of your states have already started thinking about how to use that authority, and we welcome the opportunity to work with you on this incredibly important opportunity and issue. We have also instituted a proposed rule to support home care workers' access to benefits. We've encouraged states to educate eligible immigrants about Medicaid coverage, propose steps to close the equity gaps in our system, providing really around ESRD, making sure people have greater access to care. We are, as you know, very focused on addressing health equity by building on the Affordable Care Act. We've seen such incredible changes over the last year. I had the privilege of being in Oklahoma as the state expanded the Medicaid program and seeing the enthusiasm from the advocates, state officials, and particularly the people really just showed what a lifeline Medicaid is to millions of people across this country. And we encourage states that have not yet expanded to do so, given the significant funding that is available through the American Rescue Plan. We've also been so thrilled to see the special enrollment period and what a difference it's made, where we are now at record coverage in the marketplaces. And so many consumers, thanks to the American Rescue Plan, were able to find coverage for $10 or less. Another trip was able to be in Delaware and hear firsthand just what a difference it is making for people. There was a person who was talking about her monthly premium dropping from $70 per month, and her cost of her medications that she had just been prescribed through her new coverage were $50. And so the difference that the American Rescue Plan is making really makes a difference to others. Finally, I want to talk about just how important it is for us to continue to engage with all of our community partners. And in particular is our work with states. And we know that so many of our programs, while we have an important role in overseeing and providing guidance, that you as states are in the forefront of making sure that people receive the coverage that they need. And so we thank you for all of your hard work, particularly during this pandemic. It's been quite a challenging time for everyone, but particularly for state officials who've been really on the forefront of making sure that that people had access to care and coverage during the pandemic. And that we need your help and support as we continue to strengthen the Medicaid and CHIP programs and marketplaces as we look to continue to build on the great work that we've seen this year in terms of enrollment, and hope to continue to sustain that moving forward. Thank you.
Thank you, Chiquita. We really appreciate you sharing your vision with CMS and really highlighting how states can really partner with the federal government. I know that's really important for all of us at the state level to hear. So I had a couple of questions. We had the opportunity to get a few questions from our state officials ahead of this recording and wanted to just share some of those with you. One was really about person-centered care and equity. So I think states are very interested in launching new models, addressing social determinants of health and equity in Medicaid, things like focusing on whole person care. But they recognize that they're going to need regulatory flexibility to execute models and funding to invest in the infrastructure to achieve that. So if you can comment, what may be the opportunities through Section 1115 demonstrations? We saw, under the Biden administration, under the Obama administration, there was different types of 1115s approved. There was a shift under the Trump administration, and now we're here with the Biden administration and you in charge. So what emerging models do you see, and anything else you can comment on that could help states plan for what comes next?
We are really excited as a team about thinking about how we can move and continue to move all of our programs to be much more focused on the person and really addressing health equity, and states are at the forefront of it. Dan Tsai, as I know you all know, one of the reasons why I wanted Dan to come join the team at CMS is because of his experience at a state and really tackling these issues in his state. And so we are looking at ways that we can partner with states to make sure that the 1115 demonstrations really have the flexibility and really push on these critical issues. So we are certainly open to state ideas, as well as trying to make sure that we are offering those. And Liz Fowler, who's at the Innovation Center, it's not the same authority, of course, but we are thinking as a collective team about ways that the Innovation Center can partner with states and the safety net to more to push some of these models in a stronger direction.
Great. And do you have any sort of tips on how state officials can get more involved? Is it by reaching out to you all? Is it by, submitting proposals, all of the above?
We always appreciate early discussions. And so certainly, something that states often have done, have put, short concept papers together. We really welcome the opportunity to hear from states early. So certainly Dan may, as I often say, kick me under the table for suggesting it, but he's not here. I know he'll be talking with you later, but we really welcome early feedback on your ideas, because we don't want to pretend we have all of the answers, right? Like, we really want to hear your thoughts. And as I started saying, one of the parts of in terms of our vision is really to make sure we're engaging at a much earlier level in the discussion, so that we're not baking the policy and presenting it, but really hearing from stakeholders early.
Fantastic. Thank you for sharing. So, okay, early concept papers, noted. Okay. The next area I want to talk about is workforce. So that really is the core of ensuring individuals can access care, but we do have significant gaps in behavioral health and community-based providers, such as primary care providers and community health workers. You talked a little bit about home health care workers for the increasing aging population, dental providers, et cetera. From a state perspective, investing in those types of workers is going to be critical to really getting to, person-centered care and being able to really meet the needs that are presented by the populations. So they were curious, how is CMS thinking about, perhaps in partnership with other federal agencies, investing in workforce to address these significant gaps? Are there opportunities for federal guidance around, models for reimbursement to stabilize the workforce? And how can states best partner with you all on that?
This is certainly an area of deep concern. Have been hearing about this certainly before we were in a pandemic, but we all know just what an area of critical need really across our healthcare system, but particularly in some notable places. I think it's a multifold issue, as you alluded. Not all of it is within the purview of CMS, but we are really trying to work with HRSA and our other partners across the department to think about ways that we can really support the workforce, and certainly within our own authority are paying deep attention to this area. There may also be, as you know, in the president has put forth the Build Back Better agenda, and investing in community-based services and really helping support the workforce in that area is an area of priority focus. There is funding in the American Rescue Plan that we think it gives some new opportunities to states, and we welcome the opportunity, as I said early on, for states to come to us with ideas and suggestions about policy changes that would help support in this area.
Great. I'm sure you will hear some follow-up on that from a number of state officials. Okay, just switching gears, it's all related, but just to talk a little bit more squarely about public health and the experiences that we've had in this pandemic and what's to follow. So there's been new partnerships built, or strengthened, I should say, during this pandemic across public health and Medicaid and other areas within states. And I think states are thinking about, how do we really modernize public health? How do we really bring in the healthcare system and effectively use American Rescue Plan Act funds for things like IT infrastructure and, data sharing, and really making sure we understand what's happening with Medicaid populations and vaccinations and public health outcomes. From your perspective, is there a role for the federal government to really, provide guidance or highlight best practices, or help states, think about, where are there emerging promising next steps? And would love to hear if those conversations have been going on, and what states can do to help inform. Here are the challenges we have, and here's where we really need some federal guidance on where to go next.
It would definitely be helpful to hear the state perspective about where some of these challenges exist. I mean, one of the things that we certainly are focused on are data, and trying to make sure that we are making it much more available to the public, and that we are providing it on a host of issues. which is something that we're spending quite a bit of time and investment in.
Okay. So we'll have to gather some thoughts for you all and continue to share, as I know there's continuing challenges on what to do next with IT, et cetera. Okay, just wanted to just briefly touch on a lot is happening on Capitol Hill with reconciliation. We're not going to ask you today to opine on what may or may not happen in Congress, but one of the areas that they are talking about is prescription drug costs. And as you know, NASHP has worked closely with states on a lot of ideas around addressing prescription drug costs, and some of these steps can be addressed through executive action. If you can, is there anything you're able to share around what could come next on prescription drugs within the executive branch? I know if there's anything to share, it will be appreciated by the audience here today.
This is such a critical issue, prescription drugs. I think I probably hear about this the most in terms of how it's affecting people and in very real ways. And I know that you all as states share many of the same challenges in terms of trying to control costs and also just what is happening on with the Medicare program certainly influences you all in terms of particularly around the dual eligibles. And it's so I say this to say this is a huge priority for all of us and certainly for the administration. I would say we are mostly focused right now on working with the Congress to come to addressing prescription drug costs at the federal level, congressional level. And part of the reason, and part of it is my former Hill background of just knowing that when we go through a congressional process, we are more likely to end up with a result that it ends up taking in a number of stakeholder perspectives, and we'll give CMS, I think, the authority in a way that will make it easier for us to implement. And so that's what I am hopeful and feeling. Of course, I don't have a crystal ball, but I am feeling really optimistic just given how much of a priority this is, how much alignment there is, and how much of a priority there is in addressing prescription drug costs, that CMS will be given more authority to negotiate in the Medicare program for prescription drugs and be able to really help lower prescription drug costs, not just for Medicare beneficiaries, but I think ultimately for the other parts of the healthcare system.
That's great. And I'll just follow up to just, and I know you know this, that there is obviously a deep interest on the Medicaid side from many state leaders on addressing prescription drug costs and, ideas around accelerated approval and how to provide more flexibilities to states to really have more control and authority about how to address those big ticket, big price drugs that are coming to the market. So I won't ask any more questions about that, but I'll just tee that up as an issue that I think we'll continue to hear about from the state level. I think the other thing I would just say on prescription drugs is states are looking at a number of different models. We had a summit just earlier in this conference where they were thinking about, drug affordability boards and how to, think about reference pricing. And so as you all, I know there's been sort of a plan put out by the administration on prescription drugs. And as you all think through that, I know there'll be great interest from state leaders to really continue to engage and just share their experiences from the state level of what they're trying to do as you all think about kind of what might come next at the federal level. So more to come.
Absolutely. We welcome that. And I've told everyone that at CMS, we are focused on being able to implement whatever Congress passes on day one. So I know that when it does come, we will welcome all of the advice from so many of you who are on the front lines of these issues.
That's great. And I know we only have a couple of minutes left. I might just touch on one more topic that's being debated in Congress, and that's around subsidies for the marketplaces and that extension and sort of additional coverage options, which may even include it sounds like a federal Medicaid program for those states that haven't expanded. Again, to the extent you can comment on that for the audience, anything you would share, I think would be appreciated by many.
Absolutely. I would say that taking the two issues, the enhanced tax credits, the enhanced subsidies, I think we've gotten to see what a difference they make during our special enrollment period. We saw at the beginning of the special enrollment period what enhanced outreach efforts make. So we saw an increase right around the time the administration opened up the special enrollment period as people, we put $10 million on the table to navigators, and we saw a bump up of enrollment, which was wonderful to see. And I think that shows that when people are aware of coverage, makes a difference. And then the American Rescue Plan subsidies took effect, and we saw quite a bit additional bump up. And I think that when we see that, we are seeing how when you make coverage affordable, what a difference it makes in terms of enrollment. So, some of the things that we've heard in terms of outreach and talking with consumers is really hearing from other situated people how much money they would save from these increased subsidies. It made a real difference. And that's a long way of saying, I think it's critically important that the enhanced subsidies be extended. And that's why it's in the Build Back Better agenda of the president. And then on the second front, on the coverage gap in the states that have not yet expanded and what to do, I consider this to be the unfinished work of the ACA, that there was never an intention for the lowest income among us to not have coverage. And I very much hope, and we are very happy to work with states that want to expand. I hope that states will take up the Medicaid expansion, because I do think that it is best when local officials are closer to the ground and able to make their programs more tailored to their state needs. But if for whatever reason the states are not in the position to do that, we need a federal solution. And so very much think that when you think about those millions of people without coverage, that Congress is seeing the importance of covering those. And, whether that's through the marketplace, whether that's through a federal Medicaid program, the important issue, I would say, is making sure people have coverage.
Great. Well, we are just about at time. And so I just wanted to see if you had any sort of final thoughts for the audience here today. We have many, many state leaders that I know are listening in and really appreciate hearing you today.
Just to say that we have so many things to do. It is quite daunting in some respects of how much work needs to be done, but it's also an exciting moment in terms of, I think, our country's understanding of how important healthcare is. And we really look forward to continuing to work with you to make coverage, to strengthen all of our programs and make sure it's working for the American people. Thank you for having me.
Thank you, Chiquita. And I know we'll be following up with various questions from states, and we'll continue the conversation.